Hey everybody, this is Sarah at Health by Sarah. I just wanted to give everybody an update from the last time. 2 weeks ago, I told you guys I was going to take the glucola test, and I was a little nervous about that. So I got my results back last week, and I passed. So I'm really happy about that. And I wanted to give you a reminder as to why I think I actually passed it. First of all, I eat a good balanced diet overall. So a good balance of healthy protein, healthy fat, and carbohydrates, but not excessive carbohydrates. So I normally try to shoot for that 3 meals a day, and even in my snacks as well. I really don't snack that much actually, but if you do snack, you still want to go for those healthy snacks as well. Number 2, I also ate a very high fat, high protein breakfast that morning. So I ate a bunch of eggs cooked in butter. Can't remember if I had sausage or not, but I didn't really have any carbohydrates with that. The only kind of carbohydrates I had were in the milk that I was drinking. So I sipped on whole milk up until my appointment and up until I actually took the test, because they didn't make me fast, thankfully. And I think that made a difference because my blood sugar was very well balanced when I took the test. And I also chose for the lime flavor that they had, which supposedly tastes less sweet than the other ones. It tastes like a flat Sprite or something. So it was about this much liquid, maybe, and I had to drink it within 5 minutes. And I didn't feel like my blood sugar was just going crazy after that. They drew my blood an hour later, and I didn't get the results until the following week, but I'm very happy to say that I actually passed. So hopefully this information can help you or somebody you know that is about to take the glucola test. And of course, as I mentioned in my previous video, an alternative is to simply prick your finger and measure your blood sugar that way, if your doctor approves of that. I think most doctors would approve of that. The second part today I want to talk about is low progesterone levels. In addition to drawing my blood to see where my blood sugar was, they tested a CBC, or complete blood count, and they also measured my progesterone levels, which they had measured early on in pregnancy. And at the first time they measured them, mine was within the normal range, but it was a little bit on the lower side. And so they recommended me getting injections of progesterone. I believe they were all supposed to be injections, but I opted out of that because I wrote to a homeopath and I asked, what can I take for this? My progesterone levels are low, and he told me that taking Calc Carb 30, let me get it out for you, show you what it looks like. Here's what it looks like. Washington Homeopathic is the brand. Hopefully that's clear. Even though it says overwork on there, it can be used for hundreds or thousands of different reasons, but it's really important to work with a homeopath to see if, especially if you're not familiar with homeopathy, to make sure you're taking the right remedy. So I'm just telling you this based on my own experience. It's not necessarily blanket advice for everybody, but I wanted to let you know that Calc Carb 30, according to him, is very good at maintaining a pregnancy. And that's a direct quote from him, because the risk of having low progesterone levels can lead to miscarriage in pregnancy. And that's something that I struggled with before pregnancy. As you guys probably know, I have PCOS, or polycystic ovarian syndrome, and one of the common symptoms of PCOS is having low progesterone levels. Progesterone is a hormone that's important, especially to women. If you have low progesterone levels, it could be difficult for you to get pregnant in the first place. And if you do get pregnant, it could possibly lead to you getting a miscarriage. So progesterone is very important when it comes to fertility and women's health. So that's one of my first recommendations, is taking Calc Carb 30, or a natural alternative to taking the injections. So this time I took the test, the second time around, my progesterone levels were a little bit lower, and I want to kind of give you guys my theory on why it might be lower, because the number one thing that depletes progesterone levels is stress. And although I don't think I've been having a ton of stress lately, I'm still having to travel for my job, and that included traveling to the West Coast a couple times recently. And the day my blood was drawn for my progesterone, I had just gotten back, like past midnight. I got home and I went to bed after that, obviously. Traveling from California back to North Carolina, and that was stressful in and of itself. Although I don't have a super stressful project right now, the travel itself and just the work and my schedule can be a stress on my body. So, and not getting enough sleep as well. So I definitely didn't get enough sleep the night before. So I think it could have possibly affected my test results the next day. And I just wonder if my blood were to be taken on a day or a week where it wasn't particularly stressful, where I was just home all week and getting really good sleep, if my progesterone levels would have been different. Anyway, so I wrote the homeopath again, and I said, hey, my progesterone levels are a little lower this time. Should I be concerned? And he said, there's nothing to be concerned about. Go ahead and start taking Calc Carb 30 again for the rest of the pregnancy, because right now I'm 29 weeks. I wrote them when I was about 27 weeks, and he said to go ahead and take it for the rest of the pregnancy. So I feel pretty comfortable doing that, and I just take with this particular brand, I take 3 to 4 pills twice a day for the rest of the pregnancy. But depending on which company you get it from, you might have to take a different dosage. Well, they don't exactly call it dosage in homeopathy. I'll give you an example. You can't really tell the brand on this. It's kind of faded out. This is from OHM Pharma in Texas. This particular brand, I think you only have to take one single pill and you squeeze it and it comes out one at a time. But as I said again, you got to look at the directions on the bottle to make sure you're taking the right number of pills. Alright, so my number one recommendation is to decrease your stress levels in any way possible, because as I said before, that's the number one depleter of progesterone. And that goes hand in hand with getting to sleep at the right time and getting at least 8 to 9 hours of sleep every night. So preferably getting to bed at 10. That's what all the experts agree on. And just getting a good restful sleep. So my third recommendation was the homeopathy. My next recommendation, natural recommendation, is Moxa. I'm not going to pull out the whole thing because it's burned at the end. But I showed this in an earlier video from last year when I was trying to balance my hormones. This is known as Moxa or Moxibustion. I'll definitely link to that video so you guys can do it, because I'm not going to go through all the information today. But not only does it help to balance your hormones for women, I don't know about men, but definitely for women, but it helps to prevent miscarriage and pregnancy. So the directions that my acupuncturist gave me was to burn the end of the stick, as I did in the other video, or as I explained in the other video. And once it's smoking, you put it in the center of your lower back. So the very end of your spine, essentially, in the middle of your back. And you do that for 5 minutes every day. And that is really great at preventing miscarriage. And going to an acupuncturist, getting acupuncture also goes hand in hand with that. So if you don't feel like the moxa is enough by itself, you could go see an acupuncturist as well. My last recommendation is eating foods that will help naturally increase your progesterone. So technically, foods don't actually contain progesterone, but they can make your body produce that progesterone, just as these natural remedies don't actually give you progesterone as a progesterone injection would actually give you, but they help your body to actually do what it needs to do. So some of those foods include dark leafy greens, nuts and seeds, like sunflower seeds and pumpkin seeds, fish, little dark chocolate, and some whole grains like brown rice. So if you're actually eating whole grains, make sure you're soaking them properly. And I have a video of how to soak nuts and seeds on my blog as well. So that's it. That's the last recommendation. But if you actually do decide to get progesterone injections from your doctor, I would recommend doing the bioidentical progesterone instead of the synthetic version, because that's going to be most closely related to the progesterone in your own body that you need to produce. It's still not 100% natural, which is why I'm giving you these other natural alternatives. But it's definitely better than taking the synthetic progesterone, because I think it has less side effects. And as I said, it's bioidentical, as they call it. It's most closely related to that hormone in your body. So definitely try for an alternative, but if you don't feel comfortable doing that, then do the bioidentical progesterone. Alright, so I'd love to hear from you guys if you have any experience with low progesterone in pregnancy or in trying to get pregnant. Also, any experiences with the glucola test. Alright, you guys have a great week.